Mom. Hey, Grandma.
Looking down the midline, I see that she's relatively even on both sides,
Okay.
and, which is very good. That, and so now I'd like
Put her into the craniosacral position there, so you can get the chin
Just
up.
relax, Mary.
You're used to this. I do this to you at the end, remember?
Mm-hmm.
Okay. So just soften your hands just a little bit because she's small. And then push up a little bit with the fingers so the chin goes up. You don't want the head to come back. So, there, yeah, curl under there a little bit. Just a little bit. And that's how you know you're in a good position, is when the chin comes up. So now look at her chin. You notice Esperanza had a slight shorter on the right side. Do you see that slightly there with her?
I don't see it, no.
Okay.
I don't.
Open slowly for us, Mary.
Now, she did have a little bit of a wiggle when she opened.
Okay.
Close. Open for me one more time. Okay, that time it didn't have the little wiggle, so.
Okay. She might have self-corrected because she picked up on what you were looking for.
Yeah.
Okay. Okay.
You know, the shape of her face is exact, but the, what am I trying to say? The dysfunction is not apparent.
Okay.
Okay.
But the facial is very similar facial structure.
Very
and
similar.
One of the things that we're going to be watching as we treat Mary throughout the rest of her growing up, and when she becomes famous and rich and we tour around with her, then we'll be treating her too. And we're going to be paying attention to that deviation and see if it gets worse. Try to correct it now. There's a lot of deviations. They can be structural. They can also be muscular. They can be habitual. They can be caused by something that she's doing. And if you can figure out what the cause of the dysfunction is, especially in a patient this young, sometimes you can effect a change that will prevent problems in adulthood.
I would think you can. It'd be a little easier, actually.
Yeah.
Because once we get reach adulthood, then it's kind of it's a habit that's hard to break.
We're set in stone.
Yeah, absolutely.
So I'm going to palpate, one or both of you palpate her external structures and see what you feel. Especially with children who are in growth spurts,
Is that pressure?
the body grows at sometimes discombobulated rates. One side will grow at one point and then the other side will kick in and grow. And especially in the mouth, all of that changes dramatically from childhood to adulthood. She may have wisdom teeth that are removed. Has she had braces?
No.
No. And doesn't look like she needs them so far?
So far, she seems to have my mouth, and she may have to have braces because she's had to have some teeth pulled already.
Okay.
Some baby teeth pulled to make room for her adult teeth.
Okay.
So we're not quite sure.
Okay. I'm going to check
Do you
the
have an
strength of the
orthodontist
muscle.
lined up?
Okay, Mary, if you'd
Okay.
put your tongue to the back of your mouth for me.
Try to touch your throat with your tongue.
Feels good.
Okay, so we're testing the strength of her hyoid muscles.
Okay, open your mouth. Is that pressure okay? And close again, slowly.
That was the medial pterygoid. Now you're going for the lateral pterygoid.
Now open your mouth for me.
Or actually, you're at the masseter now.
Wide. Now close for me. Yeah, I didn't feel that. I didn't feel it. The little indentation that happens.
Okay, you're at the masseter. You need to get the pterygoid. You want to be right
at the opening of
yes.
the. Okay,
and
got it.
Now have her open, and then something should open.
Okay, now open for me, Mary.
Feel it now?
Yes, I do.
Okay.
Okay, is that pressure okay? Now close slowly. Yes. Thank you. Now I need to remember that one.
When you're dealing with children, adolescents, you're dealing with a smaller version, but they quite often, especially through growth, they quite often need body work. So,
Sure.
and especially if she's going to have inherited some dental issues from her mom, that her mom responds very, very well right now to massage and intraoral massage for her TMJ. And if Mary is going to be potentially developing those problems too, right now is a really good time to start educating her about intraoral massage herself and start working on some of the external structures. You may not need to spend the time in the child's mouth like you would the adult's mouth. You may not even need to go into the child's mouth externally. You might be able to resolve any issues that they're having. But if you are going to have a patient as a career, a lifelong or a chunk of years of time, these are things that you start to notice as they develop, that potentially this particular problem may progress. And you're in a perfect position now to address it, to start teaching her and educating her about what's causing some of the things that are going on and how to correct that. And we want to take the time to make nice.
Now, another thing that I notice myself with massaging the younger generation, that they are less apt to communicate as well as the adults. They kind of, they're standoffish because they're kind of like scared, or they're more timid to, they don't know what they're supposed to feel, so they tend to take a little bit more than I feel as if they really want to.
You have to be very close to pay attention to their tolerance level.
That's definitely something that I've noticed, that I try to be more observant with the children than I am with adults. I mean, even though I'm observant with an adult, I tend to be more with a child.
That's a very good point.
And it's important to explain what you're doing.
Yes.
Another thing that you're dealing when you're dealing with younger people rather than adults is that you may need to change your language just a little bit. As an adult, you've got a million words for pain. As a child, you don't necessarily have those words. So if she's not understanding what you're asking her, then you might need to change the way you're expressing. Well, does that feel like pressure? Or does it pinch? Or does it hurt? Does it sting? You want to give her some descriptive terms to choose from. And it's always important to build a rapport, but especially if you feel like they're scared. This is very, very intense work to be doing on an adult. You probably are only going to be doing externally on a child unless there's a really, really bad problem. But communication and building that rapport, it's important that they feel comfortable and safe with you. And they may feel safe with you with mom or dad in the room. They may feel safe with you with mom and dad out of the room. You make sure you have a good communication with the patient and the parent, so that everybody knows what's going on and everybody knows what to expect.
Does that feel okay, Mary?
Sorry.
Another thing that I notice is in the younger generation is they have a lot of back issues already.
Yes.
Like the neck and back issues, and a lot of it I think is coming from like all of the heavy books
The backpack.
they have to carry. I don't remember having back problems whenever I was younger at all, but I have a lot of friends with their kids, and like maybe anywhere from 12 to 15, 16, that age, their backs, they're in so much pain.
Well, another factor there is that's an intense growth period for them. And as bones are growing, and muscles may not be growing at the same rate, or bones may not even be growing at the same rate on both sides of the body, you do end up with a bunch of imbalances. And actually, Mary's been seeing me for probably about 9 months now, maybe once a month or so. And when she broke a bone in her foot, maybe a little more frequently because she was casted and she had a lot of musculoskeletal issues from that. But we also think that some of her back pain, some of her neck pain is coming from the growth process. And it is very common in chiropractic offices now, just before school starts, that you see they have displays about the proper backpacks to buy. And some chiropractic offices even sell backpacks, or the rolling bags, and depending on what, Mary's not in a public school, she's homeschooled, but depending on what the requirements and regulations inside a school, what they can actually bring to school, dramatically affects what they go to school with too. And school has changed a lot since we were in school. There's a lot more security, there's a lot more issues that need to be considered in exactly what they're able to take and how they're able to operate in that environment. Grace, would you like to palpate a little bit too? You were asking me also about craniosacral traction.
Yes.
Okay. So Mary responds very, very well to craniosacral traction. So once you've palpated the structures in her in the maxillofacial area, then we'll do that one real quick too.
Is that okay?
Mm-hmm.
Something to remember, and I didn't realize this, is any child under the age of 18 needs a parent in the room with them. I
Needs a
believe.
parent or parental consent, yes.
Yes.
And in my situation, since I work from my home, and there's usually only one patient here at a time or one family at a time, I can leave the door open, and Esperanza has access to her, or she has access to her mother,
Okay.
and the supervision can be to whatever level that the parent and the child feel comfortable with.
Good.
In an office setting, or a spa setting, or something, or a treatment facility setting, that may be very different, and it may be appropriate for the parent to be in the room.
Absolutely.
You certainly need consent, and they certainly need to understand exactly everything that you're going to be doing.
I had a 13-year-old autistic boy that I was working on, and 18, his brother, who was 17 or 18 at the time, and I just overlooked the fact that the parent should be, although it was in their home, you know, and she had access, the door was open.
In their
that kind of
home
thing.
is completely different than in a
Okay.
medical setting, yes, so
Okay.
you were probably safe there. All right, so